is Stefanie. I'm one of the internal medicine specialists here at the Ralphs. And today we want to talk a bit about one of our most favorite and most common problems in internal medicine, which is, diarrhea. It's one of the most common symptoms and reasons for presentation, and especially out of hours, as you probably will well know. But it's usually not urgent, at least not for us, but for the carers. It is, however, a very important sign, and I see in the referrals that there are many reasons to be unhappy about, and it's usually a long-lasting problem, and many things can go wrong. But on the other hand, we should be very grateful for this clinical sign, because it's a sign which can be easily monitored, especially by the owner, and this gives us very good opportunities to treat and think about it. So first of all, of course, you can either love it or hate it. It's a really bit of a love-hate relationship for sure for many veterinarians. I personally think it's a thriller, because it's really combining excitement, anticipation, anxiety, and surprises with it. So I really do love diarrhea, to be honest. So in general, diarrhea is a very simple thing. It's caused by literally too much water in the feces, and it could be either or, due to an increased secretion or decreased absorption, or both. So what are the reasons for that? I don't know. Usually it can be thousands of reasons, and we don't know from the first presentation what's going on, but it's very important to remember that there are plenty of intestinal problems which are not associated with diarrhea at all. So especially in the small intestine, if the ileum is still functioning well and the absorptive capacity is not reached, it could be that there is never ever diarrhea present at all. So it could be you have a year-long problem and the only symptom you have is maybe he's a picky eater or whatever. So it's all super, can be non-specific, what you see as a presentation. So of course, in absolute contrast to the large intestine, which is commonly associated with diarrhea, because literally there is nothing more distal to absorb the water. So these are all interesting things what we should consider talking about diarrhea. So in general, we should always think about, is it actually worth diagnosing it or actually treating it? Because especially in acute cases, it's really the question, is it worth the cost? It really gets interesting if it's getting on over several weeks. So it's for us important to differentiate, is it more acute or chronic? Chronic means usually 2 to 3 weeks. Is it mild or severe? These are reasons which help us to how quickly we should get in action here. So it is the most important thing with diarrhea is really to slow down and really go back, take a step back and take a deep breath and listen carefully what the carer tells you. Why is that? They have all the information, they see the dog on every single day, and we don't know anything what's going on. So the most important thing is, I personally believe, is to drink a coffee first and have a deep breath, and then start with the history and a thorough physical examination. It gives you so many answers. So my first question always is to understand what type of diarrhea is actually present, and as you well remember, there is the small and large bowel diarrhea. So this is characterized by certain clinical signs. On one hand, with the small bowel diarrhea, we know that they are more prone to have weight loss, vomiting. Why is that? It's logical, because this is where all the absorption takes place, right? They are more prone to have usually no blood in their stools, not the mucoid stuff like what we know in large bowel, which is usually also associated with tenesmus and so on. So you all remember these, all those signs. Just really be careful to understand and listen carefully what your carer tells you, because this is a very important information for us. Diarrhea might change over time, diarrhea might get suddenly mixed, so there are several reasons what's going on. How big is the volume of the feces? Is it sometimes increased? Is it normal or decreased? These are all important signs for us to understand. So start listening first, and then we get going, right? So you understood basically in your first step. You have the history, you have the duration of clinical findings, and for you clearly the predominant problem in this dog is diarrhea. The most important thing is what I always start is, cannot be overemphasized, is to rule out that no parasites are present. Even though a dog has been on dewormings over years, check thoroughly, did you really rule out all types of worms, roundworms, tapeworms, etc.? The next thing is what you need to do, be thorough here to really rule out all other secondary causes which could lead to diarrhea, and this is why we usually include full bloods. It's a good time here also to add on folate cobalamin, my big friends, the vitamin Bs, B group, which are absorbed in certain areas of the small intestine, which give us an important idea if maybe there is a problem of malabsorption, maldigestion. The other thing is diagnostic imaging, which cannot be overemphasized. So even with a scope, we can only see less than 2 meters of the whole intestinal tract. The whole intestine is over 10 meters or even more long in the whole dog, so we cannot possibly see all areas here. So we need an ultrasound to understand all sorts of problems what's going on. If we have done all that and we are still slowly, clearly going in this direction, knowing it is an intestinal problem, we have ruled out major problems with ultrasound, we are happy to go ahead. The next important step is really to go in a stepwise therapy approach. So common things are common. Don't forget that. Common things are common. The most important thing, considering also the signalement of the dog, is to rule out a food allergy. So what you do is you do first a food trial, and understand the responsivity, right? So you feed an elimination diet or a novel protein source for 4 or even up to 12 weeks. This might quite take some time, but so many dogs are responsive. And it's important to understand, look, until now we haven't done anything yet, nothing invasive. It's still all what you can do at home. You don't need to refer for that. It's important to rule this out. Start the diet trial first, and then we go from there. If this is partially responsive, or you're not responsive at all after a few weeks' time, it is important to understand if there is a so-called antibiotic responsive disease. And this is what we usually do, is we prescribe antibiotics. Funny enough, not all antibiotics destroy the whole flora, but many support the good guys and destroy the bad guys, and even have anti-inflammatory properties on the gastrointestinal wall. Sometimes this is enough to do this temporarily, sometimes you need it forever. So there are several patients who need this because permanently the flora is changed, or whatever reasons are there for the response. So in this case, I prescribe it usually over a 10 days, 2 weeks course, for instance, metronidazole, tyrosine, oxytetracycline, whatever works for you, or you have experience with, and then I see how they respond. If the definition of an antibiotic responsive disease is that they respond in a very short period of time, usually the next day they are clearly better. However, sometimes it could take a bit longer, but it's usually within 24-48 hours. If this is ruled out, no response to diet change, no response to antibiotics, then this is the reason for referral. Because what are we going to do? We need biopsies. And it is of course always an advantage to take full thickness biopsies, because we get the full gastrointestinal wall, meaning this is a surgical procedure. Or of course a non-invasive procedure is to do it by endoscopy. Either or, it depends of course on the patient, on the previous ultrasound findings, if you can do that. But just to understand this whole process, what we have just discussed is that you can do all of those things before in your own practice, so you don't need us to get an action here. It's a stepwise, thorough process which is long lasting. It takes several weeks before actually the invasive diagnosis comes. So what can we do with the biopsies? It is of super high importance to understand that the gastrointestinal tract responds stereotypically to all sorts of insults. So I cannot tell you, and no pathologist in the world will tell you, if the inflammatory cell type you find in the biopsies is related to a food responsive disease or a antibiotic responsive disease, or it's IBD, the classical killer, right? So you always have to try first and rule out before you take the biopsy. This is super important. Of course, discussed earlier already that there are certain diseases which are not associated with diarrhea. It is usually advised to do an upper and a lower scope. So, however, only if you have really clearly signs and you're suggestive, of course, that you have only one location available. Sometimes it is okay to do only one location, but usually we love to do both locations, just so we can get a thorough idea of the whole gastrointestinal tract. Inflammatory bowel disease, IBD, is basically sort of the end stage diagnosis. This is usually the name for a disease complex, what we call has an idiopathic cause. So we don't know what the underlying reason is, we just don't know. There are several histological variations. They could be lymphoplasmacytic, eosinophilic, neutrophilic, indicating that the true IBD is not a single disease. There are so many underlying reasons of which we have no clue. So this is why the therapy is variable and there is no standard protocol, and I won't start here giving you therapy advice because it's so variable, but usually, as you well know, it is associated with steroids, our big friends, yeah. But sometimes it's just needed to really think about it. It's always important also to think about lymphoma, especially in cats, but more and more also in dogs, of which we think is maybe a disease continuum of the IBD previously. So sometimes we need more tests here. Immunohistochemistry part is to differentiate in the histology, but it's all made easy. Right, so the big point for me in this talk is maybe to make this all a bit clearer for how we approach diarrhea patient, and hopefully for me the goal is to be more content, to be more excited about diarrhea, because we are in the internal medicine department, we are super excited about diarrhea. The most important thing is really to listen thoroughly what the carer tells you, to do a stepwise approach, and to rule out many things before you refer actually for the actual biopsies, of which we are of course happy to do. But really think about it, and I really do so hope you enjoyed this talk, and feel free to message us, let us know feedbacks, what you want to do, if you have any questions. Yeah, please contact us and stay safe. Oh wait, I get an important memo. Who is this? Oh, is this Salmonella? Is this E. coli? Hello, are you talking to me? Yeah, you need coffee? All right, I'm on my way. Wait, I'm going.